This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Welcome back to Funny Medicine.
Hello, everyone.
This is Julie.
And this is Evie.
And today we have actually put together some listener cases.
I know. Thanks to everyone that has emailed us. We really appreciate all the stories. They're pretty funny, I'm not going to lie.
I mean,
And kind of crazy.
I was like so happy to see them come in.
I know.
I was like, people are actually paying attention to this. Like,
I know.
And please keep it coming. Like, keep it coming because, you know, we will feature you. We'll try to feature you on the future listener cases episodes and whatnot. We plan on doing this for a long time. So we need more content. We need more.
I know. We need more listener cases. And it doesn't have to be, you don't have to be a medical professional.
No.
You can be a normal patient and tell us your story. If it's funny, if it's crazy, if you weren't expecting something.
Yep.
Anything works for the listener cases, and we kind of want to try to do this at least once a month, so hopefully we got enough content so we can keep doing this.
Absolutely. So definitely you don't have to, like she said, not a medical professional. You could be Joe Schmo and something funny happened to you out and about that's somewhat medically related, So yeah, let's go ahead and start it off then, right? I mean, do you want to start or...
You can read the first one.
Okay.
Let's see.
All right. So here we go. I'll read it straight from, how I came in. Hi, my name is... Okay, so she just put it out there. If you don't want your name to be put out there, just let me know in the email, and then I'll definitely omit it or, put in whatever it is.
One of our listeners here was anonymous, so...
Oh, okay. There you go. Yeah. All right. So... Hi, my name is Katie. As a nurse, I've encountered several interesting and funny medical stories throughout my career. One incident that still makes me laugh happened while I was treating patients in the hospital. This particular patient had a mild case of the flu and was feeling a bit under the weather. I walked into the room with a tray of medications, only to find the patient engrossed in a lively conversation with his stuffed animal companion. That's actually really cute, though.
How old is this patient?
I don't know. I don't know what she said. Anyway, with a smile, I gently reminded him that his teddy bear wasn't a licensed doctor, but he insisted that Mr. Fluffy knew all the right remedies. Okay. Like, how do you keep a straight face with that?
I really want to know the age of this. This is either be very creepy or very cute.
Please, follow up this, this email and let us know in the future. Okay, so playing along, I pretended to consult Mr. Fluffy and even prescribed a few extra hugs as part of the treatment plan. Okay, this sounds like it has to be a kid.
I think it's a kid. Yeah, I think it's a kid.
The patient's face lit up and we all shared a good laugh, realizing that sometimes laughter and a touch of whimsy can be the best medicine.
So
that's really cute.
Yeah, this hits close to home because I'm pediatrics.
Yeah.
So we see a lot of this in the hospitals and the clinics and stuff. A lot of kids will bring their stuffed animals.
That makes sense, yeah.
Because it's more comfortable for them. And sometimes it helps me.
Yeah.
So if the kid is screaming and ripping off their parents' clothes because they don't want to sit on the bed, sometimes it is insane how just me listening to a fake Mr. Fluffy, his heart and lungs, okay, and checking his ears. Oh my God, kids hate the otoscope.
Yeah.
They hate checking ears. But you'd be surprised. Sometimes if you just do it to the parent or
because they gotta see, I guess it's because it's easier for them to see, oh, well, it's not gonna hurt. I'm seeing exactly what's gonna happen to me. So, there's like comfort level to that, I guess.
Yeah. No, there's definitely a comfort level. But what's funny is that Katie here is walking into the room, and I'm guessing that this kid had flu. and had like a full-blown conversation. So I don't know. I was kind of wondering if maybe if this is a kid, it's most likely they're just pretend playing and having a full-blown conversation.
Yeah.
Or febrile hallucinations.
Yeah, if it's an adult, then
yeah, and
something.
Kids too. Like there was so many kids that would have high fevers, and the parents would come out of the room and be like, "Nurse, there's something wrong with my child."
Oh no!
And the nurse would go in, and she would call me. He would call me at like 12 o'clock at night, 1 o'clock in the morning, and say, "Hey, so-and-so is having hallucinations."
Oh, boy.
And I would go, and the kid would have a fever or something like that. And kids do hallucinate.
Damn,
and they hallucinate a lot. Yeah, they hallucinate a lot. I've had kids say that they like feel things like on their skin.
Oh no.
I've had kids tell me that they're scared to be on the floor because there's lizards on the floor.
Okay.
But yeah, kids can hallucinate big time from fevers. But I don't think so. I think after reading this, I think it was just that the kid was probably just, having a full-blown conversation, probably feeling like shit.
And I mean, like, regardless if it's a kid or not, like, I think she did the right call and, like, going along with it.
Yeah. What would you have done if this was an adult?
Oh, my God. Honestly, it'd be hard for me to just, like...
If I were, like...
Poker face it. Like,
if it was my mom and dad...
I don't know what I'm doing.
I just told the doctor, like, just go along with it.
Yeah, just don't say anything. Just
don't say anything.
Mr. Fluffy's very important. Very important VIP in this household.
Do not piss off Mr. Fluffy.
Do not. Oh my God. Yeah, man. Like, I mean, kudos to, nurses and doctors and, medical staff really that have to, like, just walk into a room and not know what you're going to find.
No.
I mean, this was a funny case, but, like,
you really don't know what you're going to walk into, because Lord knows I walked into some weird shit.
That's what I'm saying. Like, it's just, I don't know. That to me would be what would stress me out the most if I had that job every day. Just opening that door and be like, oh my God, what am I gonna find now?
Yeah.
What's gonna happen now?
I know. Oh my God, I'm just wondering, at least when you're a hospitalist or in clinic, yes, you have new patients and stuff like that, but usually you have some sort of continuity.
Yeah.
I would love to know how emergency medicine physicians.
Oh my God.
Every day. New thing, every day.
They have to be adrenaline junkies to some level.
Whew.
Because you just don't know. You literally just pull up to work, park, go into your job, and it's like anything.
And it could be
happen.
literally from a viral URI to a
gunshot
wound to a heart attack to psychiatric mental breakdown,
like anything. And that's what trips me out. It's like, you don't even have the time to mentally prepare.
Nope. You're just like,
you're just going.
You're like, knock, knock, knock. Hey, how are you? I'm Dr. So-and-so. And then just...
You have to be like an adrenaline junkie. Like, if you, any emergency med, people out there, nurses, doctors,
I can
everything.
just imagine them just walking to me like, hey, what's going on?
Yeah.
Yeah. Okay. Yeah. And then that's usually the... I mean, I don't think it's for every emergency medicine doctor, but most of them keep it short and sweet.
Or you just don't have the time either.
Yeah, you don't have the time.
Yeah.
You don't have the time.
Oh man. Okay, but that one was cute. I liked it. That was awesome. All right, thanks, Katie. And follow up with us and let us know if it was a kid or an adult. That kind of changes the view.
That would change the view big time.
Yeah.
That would be either really cute or really creepy, like I said.
Exactly. All right, Evie, read the next one.
Okay, so my name is Dan. Thank you, Dan, for writing. And it says, and I hope this story gets featured. Well, there you go.
There you go.
And if not, at least some entertainment. Okay, let's see. During my medical school days, a medical student experience. Here we go. This is already starting off good. I experienced a very embarrassing and funny incident while on call one night at the hospital. Okay. That's crazy. A medical student on call.
Well, I remember Mario having to do that. Like,
I had call, but like as a medical student, it was not that bad. I mean, it was really like I was just with the resident the entire time.
Yeah.
But anyways, okay. It was during our patient rounds, and we were a group of students following our attending physician. That's literally how it's always going to be. You're just like little ducklings behind Mama Duck. And just trying not to piss anyone off. You don't want to piss the attending. You don't want to piss off the nurse. You don't want to piss off anyone. You literally look for someone that has pity on you. That was my life, at least. As we entered a patient's room, I confidently started presenting the case. I'm already getting palpitations from this.
And when he's saying confidently,
I think this is my own PTSD. Okay, I'm having palpitations for you, Dan. Okay. I confidently start presenting the case, discussing the patient's symptoms and treatment plan. Good for you. Kudos for you for at least giving some treatment plan.
Well, he's confident,
It was most likely the resident's idea, but okay. I'm so mean. Suddenly, without warning, my stomach let out a growl. Wow. Julie almost spit out her drink. Oh, which, by the way, drink of the episode.
Mimosas
with rosé.
Yeah, because we started early today, so we're like, okay,
yeah,
let's just go into mimosas once again.
Exactly. Okay, so back to the story. So I can imagine this guy presenting his patient case. Suddenly, without warning, my stomach let out a growl, echoing through the silent room.
It has happened to me, and I didn't go to med school or anything like that. But
seriously, the growling happens at the most inopportune times.
Yo, it happened to me taking organic chemistry.
Oh, all the time. Every single lecture or test.
No, it was a test.
Of course.
Silence. You could hear crickets. And I'm there, like, doing my freaking test, and all of a sudden, and I mean, even Mario was like 1 seat away from me because don't you remember we
have to sit one away from me.
He was a seat away from me, and he heard it. He just looked at me, and I'm like, I don't know.
I think my brother would laugh at this because me and my brother, during our exams too, we would also have our stomachs not even growl. They would make the weirdest noises, just like gas noises,
whale sounds.
Yeah, and sometimes high pitched sounds too. And Victor would literally say that he would like elbow himself to like just shut up.
But that would make you go, ugh.
Yeah, and then never failed. Every time that someone would have some sort of weird bodily sound, they'd they'd like shuffle in their seat to cover it up.
Yeah, that's like, no, we heard it. We heard it. But
seriously, it's most
I feel you, Dan, though. I feel you.
Okay, so back to the story. Suddenly, without warning, my stomach let out a huge growl, echoing through this silent room, of course, because it's always pure silence when that happens.
Of course.
Everyone turned to me. Turned to look at me. I can imagine how bad it was.
Yeah.
And my face turned super red with embarrassment. Of course, you wanted to die. Jesus. He was probably like, I don't know, a third-year medical student on his first rotation on like first day.
Exactly. And he wasn't even like just listening to it, because one thing is if your stomach growls and you're listening to somebody presenting, but he's presenting.
Yeah, he is the presenter. Yeah. So trying to regain my composure, I awkwardly laughed it off, exclaiming, well, I guess my stomach agrees that it's time for dinner.
Dinner? Good comeback, man.
Dinner, though? Or what time are you rounding? Oh, no, he said he was on call, right?
Yeah.
He said he was taking a night call.
Yeah.
Oh my God.
I mean, dinner could be at any time at night, I guess, if you're on call.
Yes. Oh, damn. Okay, so this is, okay. I mean, not a lot of people do night rounds.
Yeah.
So usually rounding happens during the day. So that's when you usually do your plan. You talk to the families. You have a plan for like the rest of the day and night.
Yeah.
So sometimes when you do nighttime rounds, it's either very brief, but if you're actually going patient to patient, like in the rooms, it's most likely an ICU or something like that where you need to like over.
Well, it makes sense why he's probably starving. If he's rounding in an
ICU,
if
you're rounding and starving, you're most likely been rounding for like hours.
Yeah.
Hours.
Yeah.
When I was in neo, in NICU for neonatal, like our neonatal rounding.
So that's like the
babies,
ICU
like
for
premature babies. Yeah.
Got it.
That our round started at 8 a.m. sharp. Maybe a couple minutes late. Okay, but 8 a.m. sharp. And sometimes we would be rounding well into 1 to 2 in the afternoon.
Damn.
Yeah. It was bad.
That's rough. Okay.
Yeah. Anyways, everyone turned and looked at me and my face turned red with embarrassment. Trying to regain my composure, I awkwardly laughed it off, exclaiming, well, I guess my stomach agrees that it's time for dinner. The entire team burst into laughter. They were very embarrassed as well, I'm sure.
Yeah, I'm sure.
And my attending suggested we wrap up rounds quickly to prevent any further quote-unquote vocal contributions from my stomach. He's like, from that day on, I made sure to have a hearty snack before heading to call, just in case my stomach decided to make up its presence known again.
Oh my God. I mean, we've all been there.
Yeah, we've
all been there, and
we've been there, Dan.
And that was accentuated because you're presenting.
Yeah.
You know, you're
I
right
feel like
there,
you're just nervous.
Like,
you haven't eaten because he's a medical student, so you're probably coming in an hour before you even start your call.
Right.
To prep your patients, to prep rounds, to prep all these things. And, you know, it's hard. Like, some people are like, oh, you know, it's just rounds and all these things. Rounds is awful.
I remember Mario telling me the same thing, and it's just tiring too.
It's tiring, and it's like, you know, it's this pressure that you have on you to like present the correct information, and it's all part of training.
Yeah,
but
it's a lot.
It's a lot for one person that's not used to doing it.
Absolutely.
Yes, if you're an attending of 50 years and you're looking at me, you're probably like, keep going. Like, I already know, and that's the thing. The attending knows everything.
Yeah.
The attending knows all the labs.
Yeah.
They know everything. They've pre-charted already every patient, and they already have a plan. They probably are not even listening to you because they already know what they're gonna do.
Yeah.
Okay. But you know, it's really, and sometimes if the student is off, the attending goes straight to the resident and they're like, what is this? Did you correct this person? Did you teach this person? Why are they presenting wrong information? You're in charge of them.
Oh my God.
Yeah. That's how my residency was. The students, they would get feedback, but we would get harder feedback on why we weren't a good leader.
The residents.
Yeah.
Oh God. Yeah, I mean, you're
no pressure.
Yeah, no pressure. No pressure. I mean, we know, like, at least I know that residency is hard as shit, but like, that's part of the stuff why I like these listener stories.
Yeah.
Because it gives other people like good insights that we haven't covered or whatever. Because I mean, you gotta listen about, a story from somebody,
Yeah.
Like that's the way you know. So, but that was awesome. All right. So thank you, Dan, right? Yeah, Dan. All right. So I'll read the next one.
Yeah.
All right. So, hey, Funny Medicine. This is Alan. Hello from Belgium. Yes! Oh my God! Hi!
International.
That is awesome.
I can't believe we have a listener from Belgium.
I know.
I'm like, what?
And I really want to go to Belgium. Chocolate.
Yum.
And their beer. My favorite beer is from Belgium.
Yeah.
Oh, God. Anyway, Alan, I really want to go to Belgium. I don't know where in Belgium you are, but I want to go over there. Anyway. I had an elderly patient who was convinced that the microwave was responsible for transmitting secret messages into her head. Oh my God. Okay.
That's a psych patient for sure.
Yeah. Anyway, she was adamant that it was a government conspiracy. Okay, so we're not the only crazy ones here. We're not the only ones. Okay, so you see? Okay.
Well, I mean, COVID, the COVID vaccine is a microchip.
Yeah. I'm not even. Anyway.
Not our cell phones.
Yeah, exactly.
Not Alexa.
No, which, I mean, how many times has it happened that you're talking about something and then you just scroll and there's an ad exactly for that?
Can I tell you something? My brother mentioned to me, I mentioned to him that I was having some dandruff in my hair. And he said, hey, have you tried the Prose shampoo?
Mm-hmm.
And I said no. I had never heard of Prose before. I hadn't even looked at it. I hadn't put anything of Prose in my phone.
Yeah.
Nothing. It was literally Eric just telling me, hey, have you tried Prose? It's been great for me. Oh, cool. Never Googled it. Never did anything. It was just a conversation in passing. Tell me how that night I got an ad for Prose.
You see what I mean? That's it. That's literally it. It's happened to me so many times. It pisses me off. At first it would freak me out. Now it pisses me off. Because I'm like, can you stop?
Who's listening to me?
Can you fucking stop? Like, it happened to us with like some cruises. We were like, oh, let's look at Celebrity or whatever. Because back then we were thinking of doing maybe the Disney cruise with a kiddo. All of a sudden, it was all Royal Caribbean, MSC, like everything on. I was like, God damn it. Anyway. All right. Sorry about that, Alan. But yeah, definitely. I understand the microwave thing because, there's crazier stuff out there. But anyway. So to put her mind at ease, I prescribed a special microwave blocking tea. That's pretty freaking smart. Anyway, it was just a regular chamomile tea and a splash of milk. She sipped it every night as she felt safe from those pesky microwave messages. Sometimes laughter is the best medicine, even if it's just some regular tea. That's actually pretty brilliant. I'm sure that patient would need like actual psych meds too.
Yeah.
But at least for the moment and just like a little placebo is not going to hurt anyone, you know? Like,
Yeah. Sometimes with patients that are having some delusions and
Yeah.
stuff like that, it's really hard. Psych is all about redirecting.
yeah.
You know, if you're feeling a certain emotion, we redirect you to something a little bit less intense.
Right.
So they really know how to redirect patients. And I can't, you know, this guy was probably just like, hey,
Yeah.
oh yes, the microwaves. How do I not have her
Freak out.
freak out and jump out this window because this microwave is sending her messages?
Or
And it
get
was
aggressive.
a simple tea that he probably got from the patient lounge.
Jeez, it's so much easier than or the patient getting aggressive and
Yeah.
that becoming like a huge issue.
Oh man, when I was a student and we did our inpatient psych ward
Yeah.
rotation, ooh,
That was Mario's worst.
my medical student peers.
Yeah.
So we were grouped, right? So our group did rotations together,
Mm-hmm.
and I loved my group. It was my really good friend Tanzib and Maddie, which is now my roommate's husband. Oh, I'm like having memories of everyone. But anyways, me, Tanzib, and Maddie, we all did our rotation together, and there's some stuff that you see there that you get in a very awkward place, especially as a little student,
Yeah.
okay?
Yeah.
That doesn't know the ins and outs, okay, of an inpatient psych ward.
Yeah.
Okay. And don't get me wrong, a lot of those patients are completely stable. They're just there for medication management and they're doing pretty well.
Right.
But there's ones that they're really tough cases.
Yeah.
And we had a patient one time with a dementia type of delusion, like acute delusions.
Okay.
And he was like 8 feet tall.
Oh my god.
Okay, like 200 pounds.
Uh-huh.
Okay, and I am 5'4". Okay, like 140 pounds. With my little white coat, my student white coat. And he's like, I want to leave.
Oh Jesus.
And he comes up to me, of course,
Of
because
course.
no one leaves any computers open for the medical students. So what computer is the only one open? The one that is literally right behind the desk of where they separate all the inpatient patients
Oh god.
from the nurse's station.
Yeah.
So I have to do my notes and I
Right.
have to do all these things. So I'm like first line of attack for all these patients asking me questions.
Oh god.
And this man is, you know, screaming off the top of his lungs, and he's like, I want to speak to my family. And as a student, you're also like in between a rock and a hard place because you don't really know the rules.
Right,
You
right.
don't. It's like my third day on psych,
Yeah.
and you don't really know. So I'm shitting myself at this point. I'm
Yeah.
shitting myself. I'm like, this guy is gonna literally jump over this little piece of shit desk, okay, that's like 80 years old because the hospital hasn't been renovated in years. And
my
he's gonna
God.
come and he's gonna punch me in the face for sure. And my friend, so I swear, my friend Tanzib, because we would do notes together,
Yeah.
he was right next to me
Okay.
when that happened. And when I turned around to look, he was gone. Gone. Oh my god. He left me by myself. He left me. He left me to get attacked and to die on my own. And when I turned around and I didn't see him,
Oh no.
he was like in the corner of a room laughing.
No.
Because he's like, I can't do it. Well, you know, goes to show, guess what specialty he went into?
Psych.
Psych.
Fucking shit. But how'd you deal with it? Like, what happened with the patient? Like,
Oh, no, I just told him, I was like, sir, I can get someone to help you.
Yeah.
I'm really sorry. I'm not very familiar with how phone calls work,
Yeah.
but give me a second and I can get a nurse to help you.
Right.
And of course, you know, he probably thought that I was a nurse, and
Yeah.
just because I'm female, not because of anything else. But he was like, oh, how can you work here and not know the rules? But
yeah, it's not.
when you're in that situation,
You're not going to be able to reason.
Yeah.
there.
So
Your story.
One more patient story. I had a patient that I felt bad because he didn't speak English. Mm-hmm. So he was from, I think, Pakistan, if I'm not mistaken.
Okay.
And he spoke zero English, and I did not understand him. And he spoke just a little bit, but nothing to like really get a good history from. But he was having a acute delusion, and I'm talking about this guy was like walking the hallways, singing songs that no one knew or no one understood.
Yeah. He's living in like in a different.
Yeah, he was in a different world.
Yeah.
And unfortunately, he was really dehydrated because he stopped eating. He didn't want to eat anything. He didn't want to drink anything.
Yeah.
And we tried talking to him. We tried kind of calming him down. He was actually very calm. But at the same time, like, he would have his moments where he would get agitated.
Okay.
And my resident is a really nice resident at the time. And he says, hey, do you want to try, like, an IV on this patient? And I was like, what? And he's like, yeah, an IV. So he was so dehydrated, though, that all his veins were, like, collapsed.
Yeah.
So they were trying, and he was nervous. He starts singing these delusional songs, and I'm less than a foot away from him trying to get this vein that's completely collapsed.
Oh, no.
And in my mind, I was like, oh my God, what is he singing? Like, is he singing how he's going to kill me right now?
Yeah, that's the thing. It's a different language. You don't know.
Yeah, I don't know. And a lot of things are going through my mind. Like, he's going to kill me.
Yeah.
He's planning my death.
It would be going through my mind too.
He's going to take this needle.
Oh, no.
And he's going to stab it in my eye.
Oh, no.
Yeah. But no, I just told him, I told the resident, I was like, listen, this guy is way too dehydrated. Let's see if we can kind of get him to drink something.
Yeah.
And then you can do it.
Right. What the hell?
Yeah.
Oh, my God. Okay. All right. So I think I was the last. Yeah. So you read this one.
Okay. We're on number 4, right?
4.
Yeah, 4. Yeah. Okay. Hey, my name is Lindsay, and this story happened at my small town's hospital. Our town is a small conservative town, but I got some tattoos while living in New York while in college, just to give context to the story. Okay. I moved back home about a year ago once my mom started to get sick, and these days she's in and out of the hospital. Okay. A couple days ago, I went to visit her after I left work for the day and hoped to bring her some comfort since she was kind of complaining about her bed, maybe?
Yeah.
Is that? I think she a little
probably.
typo. Okay. So about her bed being uncomfortable. However, as soon as I walked in, I couldn't help but burst into laughter. There she was, sitting upright in the bed, adorned with a colorful assortment of temporary tattoos on her face and arms. I wonder how old her mom is.
I know.
Apparently, my mischievous niece am I saying that right?
Mischievous?
Mischievous?
I would say, yeah, but maybe I'm saying it wrong too. I don't
The
know.
frosé is getting to me. Okay. Apparently, my mischievous niece had paid her a surprise visit earlier and decided to turn grandma into a walking art exhibition. My mother, initially shocked, had embraced the silliness and proudly showed off her newfound ink. Nurses and doctors passing by couldn't help but chuckle at the sight. It was a priceless moment of unexpected humor that instantly lifted our spirits and reminded us of how powerful laughter is in the most challenging times.
That's cute.
That is cute.
Yeah,
I wonder what kind of tattoos she had on.
Oh my God. They gotta be like kid ones, like, you know, those temporary little, because it was a niece.
Yeah.
So it had to be, oh my God, like probably like
Toy Story on the forehead.
Exactly. Like, you know, little dumb stuff like that. But that's really, really cute. I like that a lot.
Oh my God.
Oh my God. But yeah, and that sucks. Like having to go see your mom that she's in and out of the hospital. And then it's nice to like, you know, you're walking in there like, let's see how she's doing. Like, it's just another day of visiting my mom in the hospital type of thing, you know? And then you walk in and see that. I mean, that's great.
I know. That's why PEDS is great. Everyone should just go to pediatrics. Shameless plug. No, but I can't imagine all the tattoos. And you know how kids are. Once they've got one tattoo on, you think that you're just going to escape with one tattoo? No. And no. They don't want the tattoos on them. They want the tattoos on you. All of them. All 50 in the pack.
Oh, God.
Or at least I feel like that's how Nora would do it for me.
Exactly.
She always, if she has something new, she'll just give it to me.
Oh.
Like, you do it. you do it. And I'm like, no, you. And she's like, ah! She'll start screaming. I'm freaking out. I'm like, okay, I'll do it.
Yeah. Oh my God. Yeah, no, I'm lucky that my kiddo, he's so anal about things that
I wonder
he
how
doesn't...
who he got that from. Well, I don't know. Mario's pretty anal about stuff. And so are you, though.
Yeah, so he's
Like the
got it for both
shaving every
sides.
day.
He can't get over that one.
That's in our hair loss episode for those that don't know that.
Yeah, go check that out, episode 3. But, oh my God, yeah, no, I mean, we did it in school. Like, it was one of these little bazaar events or whatever, and they were like, you know, in the goodie bags, there were like these little temporary tattoos, and his friends all around him, like his best friend and all that stuff, they were all putting it on, like with the little water thing, you paste it on, whatever. And they were like Spider-Man and whatever.
Yeah.
And his favorite is Spider-Man right now. At least right now. It'll probably change next month. But I'm like, look, it's a Spider-Man one. You want me to put it on your hand, you know, whatever, like your arm? He's like, you know, sure. He was thinking that it was a sticker at first. When I put it on him and he saw that he couldn't like just peel it off.
He freaked out.
Turmoil. Like chaos, calamity, destruction. Like I had to ask the teacher, please give me like rubbing alcohol or something to take it off, because he was just like not having it. He was not having it. And I'm like, Baba, it's not a sticker. It'll come off later when we shower. Like, oh, come on. You know, those things that cost nothing. Probably by the end of the day, it would have been gone, you know? No, off. Take it off. And I'm like, oh, Lord, okay, fine. I'll take it off. And once I took it off, it was fine. And then he found another one. And in his same goodie bag, there was like another one. I'm like, okay, but let's not put it on you. He's like, no. Don't. And he just like put it to the side. Like he still wanted it. Like he didn't want me to take it away from him or anything. But he's like, absolutely, don't put that on me.
Oh my God, how funny.
He's so like, anyway, but
he's like, wait a minute, this is permanent?
Yeah. I don't have the commitment for this.
Exactly. That's why I still, till this day, I don't have a tattoo.
Yeah, Mario doesn't. I don't have one either. Neither does Mario. I mean, in another life though.
No, I'm not saying that I would never get a tattoo. I would love to get a tattoo. I just still haven't found anything that I really want a tattoo.
I honestly think in another life, I would be like with
all tatted up.
All completely. Like sleeves and the thing. Like I follow this girl on TikTok. I have like this crush on her, honestly. Like full disclosure. I think she's beautiful. Like gorgeous. And I think her name is Sammy Jeffcoat.
Okay. I don't know her, but
I will show you her. Beautiful. And her tats are like, she's all tatted up, and she's a model and all that stuff. Gorgeous. And like she has all these random tattoos of like even just places that she's gone or whatever. They're all like colorful but yeah, you're gonna look her up.
Yeah, I'm looking her up. Sammy what?
Sammy
Jeffcoat.
Yeah.
Okay.
Yeah, she's like really popular.
Oh, I know exactly who she is.
You have to know.
She's the British girl. Well, yeah. I think she's British. Right?
I'm pretty sure, yeah. But like
Yeah. Oh, I know exactly who she is. Yeah. I love her.
I love her too.
I actually wanted to buy a perfume that she recommended, but it was like
she's super popular. Like
$300.
Oh, no, I know. I mean, she wears like all
designer things. I love her outfits.
On point. That's what I'm saying. Like in another life, I'd be something like that, like edgy, just like out there. And right now, look at me. I'm in an Old Navy t-shirt and jeans and sneakers. I'm like the polar opposite of her, like extreme polar opposite of her. Yet I'm like, I want to be you.
Please teach me your ways.
Teach me. But anyway, so yeah, next story, I guess.
Okay.
You read the last one, right?
Yeah, I did.
Okay. All right. So, this is the anonymous one you were talking about. All right.
Yeah.
So this is from Anonymous. As a surgical tech, I had witnessed many intense and unpredictable moments in the operating room, but nothing prepared me for the shocking twists that unfolded during one particular surgery. We were in the middle of a delicate procedure when suddenly a loud buzzing noise filled the room, accompanied by a flash of sparks. Okay, at that moment, because I listen to way too many paranormal and true crime podcasts, I'd be like, there's a ghost in here. There's a ghost in here.
Every time there's been times where at the hospitals, like there'd be like flickering lights, or I've had the electricity call off, but we have generators and stuff.
Yeah.
But every time that happens, one, I freak out.
Yeah.
Two, I freak out because I'm like, did my notes save? You have no idea. Once, when I was an inpatient peds, we had this complex kid, and his notes are very long and detailed. And, these are notes that other providers are going to see. Yeah. So, and you're the primary team.
Yeah.
So, and it was at the end of my shift. It was like 5 o'clock in the morning.
Now you're done.
And I am exhausted. Yeah. I'm done. It was probably like day 6 of 7 of 7. I don't know. Something like that.
Yeah.
And can you believe that there was a power outage? Jeez. And the note did not save.
Oh my God.
And I took a minute. Yeah. I took a minute to myself.
Yeah.
Because I thought that I was going to have...
Yeah. A conniption.
Something was going to happen to me in that moment. And I think everyone knew that because my team was already almost getting ready for sign out. And someone, thank God for this person, someone came up to me and they were like, hey, don't worry. Like, why don't you do the last part of the note and I will focus on doing the first half of the note.
Thank God. That's really nice.
Because, listen, if it wasn't for this person, I would have just walked up and left. I would have just been like, I'm sorry, day team. You're going to have to do this because I'm just kidding. I wouldn't have done that. I would have just cried and I would have but I wanted to die. Anyways, just reading this, the flicker of lights and stuff, it's like PTSD. Like, but did you save your note? But did you save the vitals? Did you write down everything? Are you going to have to backlog like 4 hours?
Oh my God. No, I can't even. That's extremely painful. But okay, so... Flashes, there was, while we were in the middle of a delicate procedure when suddenly a loud buzzing noise filled the room accompanied by a flash of sparks. The surgical lights flickered, causing a momentary panic among the surgical team. Oh my God. I hope it wasn't like...
I wonder what kind of surgery this was.
I mean, he did say it was like...
Because if this is like ortho surgery... It's like, what kind of tools are they using at that moment? This is neurosurgery. What part of the brain are you in right now?
Yeah. I mean, I don't want to say he or she. Like, I don't want to misgender this person. But, like, they did say, like, that it was a delicate procedure. In the middle of a delicate procedure. So, God only knows. Anyway.
I mean, anything with a surgery is delicate.
Yeah. So, okay. It turns out that a tiny rogue mouse had managed to sneak into...
Fuck that. Nope.
Into the operating room and inadvertently chewed through the electrical wire.
Where is the electrical wire? And where is this mouse? And where are they practicing?
Oh my God. Okay, amidst the chaos, the mouse scurried away, leaving us all in disbelief. To say the least, our lead surgeon was incredibly pissed off, however, did start laughing. The incident served as a reminder that even in the most controlled environments, life can still throw us amusing surprises when we least expect it, and I was sure laughing.
Okay. So let me just paint a picture here.
Oh my God.
In surgery, you have to scrub in.
Yeah.
Okay. So that means disinfecting everything, okay, that's going to be touching the patient. Okay. So once you are scrubbed in, that's like the whole entire thing that people see that we like wash our hands
like
and stuff like that. And then, exactly. And then you walk in with your hands up, dripping in the air. Okay. And then there's a person, usually a scrub tech. Okay.
Yeah.
That is already waiting for you to literally like hanging up your oh my God, I'm like, I can't believe
your like PPE, like your protective gear.
It's like your protective gear, but they're like holding up the body part, right? So you put in one hand, you put in the other, then they put in a glove, they wrap you up, then you put on another glove, because a lot of surgeons like to do what's called indicator gloves. So it's like if they like scalpel, then the bottom glove will show green, so you know that there's a break in your glove.
Oh, that's so cool. Yeah. I didn't know that existed.
Yeah, so those are indicator gloves. And then, so you're literally sterile.
Yeah.
Okay?
Yeah.
And then a mouse. You see a mouse. Anything can happen. We live in a world, okay, where there's animals. Okay?
Yeah.
It could have been a roach. Who knew? But a mouse, okay? You cannot move. You cannot move because if you break scrub, it is no longer a sterile field.
Now, the thing is, this person, obviously, he's anonymous. She, they say, sorry, I keep doing that. I will correct myself. They did not say where they're from.
No.
So... it could be anywhere.
No, it could be
You're talking about like technique here in the States. But I mean, I remember when Mario was a med student and he did have to go to Grenada to their hospital to do several, like, you know, smaller rotations or whatever. And the stuff he saw at their they have like private hospitals, they have like smaller clinics and whatever and all that, but the students had to go to like the hospital, like the hospital that everybody, like the general hospital of the whole island. And that's like just, you know, government type of, like, you know, an example is like tubing, like surgical tubing or just general tubing, medical tubing, was hanging up like in fresh air in one of like the walking hallways that was like out in the fresh air, drying.
Oh, great.
So that gives you an example of like what to expect. So I don't know, maybe this person could have,
I mean, girl,
probably not here.
The pictures that I've seen on hospitals from Cuba,
that's it. You know, like
it's awful.
No.
It's awful.
And the stories, like my mom still has family over there, and the stories that they have to take their own linens.
No, they do. My aunt, unfortunately broke her hip.
Yeah.
And she's a heavy lady.
Yeah.
So the only way that they were able to get her not into an ambulance, into the back of a truck.
Jeez.
Okay?
Yeah.
Because that was the only form of transportation to the hospital. Okay? Was putting a blanket under her, okay, and putting her onto the truck with the blanket. That was the same blanket that she got admitted to the hospital with. That was the same blanket she used on the operating table. And that was the same blanket she used post-op. What the F?
I don't know. And that's why when I hear like some people out there, you know, that they have no context other than like just the stuff they hear in the media and whatever, that, oh yeah, Cuba has like wonderful hospitals, they have excellent healthcare. I'm like,
I'm not saying that. I mean, the doctors are fantastic because they literally have to work with nothing.
They don't have, they have to have such clinical,
but there's no antibiotics, there's no suture material. I had to send suture material to my family, sutures,
and these are the things that people don't know. They don't know this at all, yet they're like, oh no, but they have excellent healthcare. I'm like, stop talking. Like,
stop talking. People are gonna laugh at you.
Just stop. Yeah. But anyway, so going back to this could be anywhere.
Yeah, it really could be anywhere.
It could be anywhere.
But I can't imagine, because if I saw a mouse,
oh god,
and not breaking scrub.
Yeah, I mean, scrub over there might not be as strict here as here. You know, like.
But I'm just telling, like the reaction of a mouse. So I'm sorry, I'm gonna put one of my friends out there. He's one of my medical school friends. He's this he looks like a freaking football player.
Okay.
His name is Kevin. Kevin, I love you so much, but I have to say this story. So we were in the library one time studying.
Okay.
And I was in a cubicle, and he was in the cubicle in front of me, or maybe at a table. I can't remember.
Yeah.
But point is that I went to go get a book out of my book bag, and there was a mouse.
No.
Yeah, there was a mouse.
Wait, where?
Like just scurrying, like down, like the little cubicle wall.
Oh my god.
Yeah, so I, for some reason, I'm not afraid of mice. I'm afraid of rats.
Yeah.
Okay, and I'm afraid of a mouse if it comes at me. But it was safely far away from me.
Yeah.
So I tell Kevin in the library, I'm like, Kevin. And then he looks at me, and I was like, there's a mouse. Like, but I casually said it. And he's like, in the library. And he used to work at the library, so he used to close, but he was also studying. And he was like, he goes, I'm sorry, what? He's like, you said what? And I'm telling you, he's like massive. He's like a football player. And then I was like, yeah, there's a mouse. I literally just saw a mouse. And he's like, oh, hell no. Oh, hell no. And he starts packing up his bag, and he's like, where'd you see that mouse? And it was first floor, like, of the library. It was, I mean, we only had a one floor library, but we had other study rooms. Yeah. And he was like, everyone is quiet studying. And he's like, where'd you see the mouse? And I was like, oh shit. He's gonna have a moment right now. He's having a moment. And oh man, it was so funny.
Oh my god.
I would have never guessed that he would have had that reaction to a tiny little mouse. It wasn't even a rat. It was like a tiny little mouse. But he's like, oh, hell no, I can't even study here right now. He's like, oh, hell no. He's like, where are we living right now? Where are we living?
Oh my god.
It's so funny.
Oh my god, that's awesome. Yeah.
But it
yeah,
happens.
like
It
does.
happens. And
It
crazy
does.
things happen like that. And it doesn't have to be just out of the United States.
Yeah.
We definitely had a case when I was a student that one of our other medical students said that during the surgery, a nail from the roof.
What?
Yeah, a nail from the roof was loose and fell right into the patient.
What the fuck?
Yes, into the patient. I mean, how precise is that?
That's crazy, man.
Yep. A nail just, was loose and then it, life, it just
Yeah.
went boop, and
Oh my
contaminated
God.
the whole entire
Yeah, of course.
Yep.
Oh my God. Whoa. Wow. Okay. Well, this was an awesome episode. This was a lot of fun.
I know. I kind of like these. I
Yeah.
really hope we get more listener episodes. Please, everyone, keep sending us stuff.
Keep sending it. We will definitely do our best to read. We'll definitely read through all of them for sure.
Yes.
But we'll definitely
These were the ones that we got so far.
Exactly. These are the ones that we have so far. Through email, and I think one of them came in through a DM. But anyway, email it to us, funnymedicine305@gmail.com. And it could be anything, as long as there's something in there that's touching a medical thing. That will work.
That's enough.
But anyways, what the hell?
Anyways.
What was that?
That was your froze.
Yeah, that was it. All right, well, we'll catch you all in the next one, and see you next time.
See you next time, everyone. Bye.
Bye. Like, comment, review us on all streaming platforms: Spotify, Apple Music, Amazon Music, etc.
Check us out on Instagram and TikTok at Funny Medicine Podcast. Our Gmail is funnymedicine305@gmail.com. And remember, we are not diagnosing you.
Definitely not. Just funny stuff.
See you later, guys.